Doctors of Reddit, have you ever seen someone outside of work and thought, wow, that person needs to go to the hospital now? What were the symptoms that made you think this? So this police officer rolls up to an altercation between a guy and his weed dealer. Apparently the dealer sold the guy fake weed. The guy came back angry when he opened the package and found oregano inside, and he and the dealer got into a big fight. There were a bunch of punches thrown, and the dealer apparently stabbed the guy in the chest with a small knife he had. Emphasis small. By the time the cops got there, they were both just screaming at each other. The purchaser accused the dealer of stabbing him, but insisted he was fine because it was just a pocket knife. Arrests were made. Because the purchaser got stabbed, the cops insisted he needed to go to the hospital to get checked out. When I talked to the arresting officer afterward, she said he just seemed really anxious, pacing around, kind of sweaty, and the ambulance was taking a while. I finally just decided to bring him in myself. So of course that really small pocket knife had lacerated this guy's right atrium, and his pericardium was filling up with blood. He tamponaded and arrested when he hit the door. I honestly don't know that we would have saved him had not I been on call with a former military trauma surgeon who basically cracked his sternum open in the air. But we did. I tracked that cop down afterward to tell her that she 100% saved this guy's life. If they had waited another 10-15 minutes for the ambulance, the guy would have died. No question. Saw the man sweating profusely, eyes popping out in the middle of winter with a light sweater on. Told him to see his GP today to get a thyroid blood test today and get referred to an endocrinologist for Graves' disease. Called me crazy and to mind my own business. Ended up seeing him in clinic next week during my endocrinology rotation. Hi doc, sorry I called you crazy. I'm a doc, and a few months ago my wife and I were at a restaurant and an older gentleman passed out, fell down and hit his head on the counter. He was unconscious for probably 30 seconds. I went over and checked him out. He came to, was a little confused, and blamed it on his blood sugar, actually passing out from a blood sugar issue then bouncing right back, and being awake without eating drinking would be pretty rare. I asked medical history type questions and found out he's on Coumadin, as evidenced by multiple bruises on his arms and head. He had a nice big cherry on his head and a huge bruise over his temple, and told me that he passes out all the time, so this wasn't a big deal. 1. With multiple syncopal, passing out episodes at his age, he likely has an arrhythmia which could be dangerous and needs to be checked out. 2. He just suffered a head injury and is on blood thinners and could have a brain bleed. 3. He had a head lack that probably could have used closing. I highly advised he go get checked out at the hospital, but he of course refused because, again, this happens all the time. It amazes me how the observation is I randomly pass out all the time, and they conclude this isn't a problem. It was not exactly outside of work, but I was not the MD's patient. I took my 8-year-old son for a consultation with a pediatric neurologist. He was really nervous and didn't want the doctor to examine him, so I'll let the doctor test my reflexes first to familiarize my son with the process. When the neurologist stroked the bottom of my left foot, my toes fanned out instead of curling in. This is not supposed to happen. The neurologist didn't like some other results as well, and asked his colleague to take me on as a patient and admit me to the hospital for further testing. Testing indicated multiple sclerosis, but more importantly revealed white blood cells in the fluid around my spinal cord. Infections of the central nervous system are extremely dangerous, so I was extremely fortunate to be diagnosed quickly. The girl I was dating worked at a daycare. She had her regular parent-teacher conference one night, and told me she was dreading having to tell one family that their 8-month-old was developmentally far behind compared to the other kids. He wasn't crawling yet, and was barely able to pick up his head when lying on his back. She tells me that he's still a cute kid, but has a really big head. All these are the typical signs of hydrocephalus, a condition where fluid gets trapped inside the brain. I asked her to have the parents see a neurosurgeon. The kid ended up having surgery to have a shunt placed, and has now developmentally almost caught up to his peers. When I started medical school many years ago, my buddies and I came home after our first year and noticed our friend Dave had lost a ton of weight. For the next few days, we all made fun of him as he ate a lot, dozen donuts in one sitting, and drank a lot of water. He felt crummy the next weekend, breath was noticeably sweet, and we made the straight out of the textbook first year med student diagnosis in our heads. We hauled him to the ER where they admitted him. diagnosed him diabetic ketoacidosis as the first presentation of type 1 diabetes mellitus, and started him on IV insulin. Dave went on to many great things. Not a doctor, but I love watching House. This is important. My mom was a piano teacher and had a student who broke her femur playing soccer. Full speed collision with another girl and it just snapped. Anyway, she was having tons of problems in the hospital. Coded twice. Respiratory issues. I remember watching an episode of House after the Super Bowl where he diagnoses the woman in Antarctica. The issue was an improperly set broken toe, which was throwing marrow into the bloodstream. I mentioned this to my mom when I heard about it. She mentioned it to the girl's mom. The mom brought it up to the doctors. LOL, no way. She coded again, so they made the doctors check. Yup, improperly set. Thanks House. I'm not a doc, just an EMT. A few years ago I was leaving a movie. I stopped to use the bathroom and as I stood at the urinal, I was overcome by the smell of a GI bleed. There were 3 or 4 people using the stalls, and there were a total of maybe 12 people in the bathroom. I didn't want to make things weird, so after some hemming and hawing I decided my best course of action was to awkwardly yell, "One of you is bleeding from your digestive tract and should go to the ER ASAP," as I ran out of the bathroom. I work at a hospital, but not in a department that sees many life-threatening medical situations. A higher up in my department went to a fundraiser with a bunch of other department heads and found herself talking with a neurologist. When she started complaining about an on and off numbness in her fingers, the doctor noticed that her smile was a little uneven. Long story short, she got brain surgery the next day to remove a massive brain tumor. Not a doctor but possibly saved a life. My wife works for a charity that provides all kinds of support for children with cancer as well as their families. I learned the signs of retinoblastoma when a family moved into her work for treatment. I noticed the same signs in pictures of a co-worker's grandchild. I forced myself to make small talk and mention it. Sure enough, the child had retinoblastoma. It was found early enough that they were able to save the eye. I had a med student diagnose me as a teenager in a bookstore as having migraines. I was reading and all of a sudden I lost all vision in my right eye. I yelled that to my friend who was standing next to a med student who was browsing in the same section. He did the smile test to see if I was having a stroke. I wasn't. He told us to get to a hospital just in case but warned that a horrible headache was probably going to start. Went to the ER and sure enough as I was getting checked in, a red hot pain started behind my eyeball. Ta-da, migraine. Funny you could diagnose this and it took me 4 doctors. Multiple tests, no answer. Then 3 years later my eye doctor was just like, "Oh, it's an ocular migraine, no big deal." I seriously thought I was dying on and off for like 2 years ignoring it years until this guy explained it. I'm an optometrist and I can spot a child with a vision defect at 10 feet. Not all, but particularly the far-sighted, amblyopic and those with strabismus. Even a slight eye turn is so obvious to me because I look at eye alignment over and over day in day out. Not a doctor but my daddy's. Every morning at 4:30 AM we do boxing and general fitness training. Dad was looking a little crap and under the weather but insisted that he was fine and that he just didn't get enough sleep. 45 minuets in we're sparring, he's starting to go pale. I point this out to him. Dad sort of just freezes and tells me to get my phone or call an ambulance. He then proceeds to just drop like a sack of rocks. Turns out he had a blood clot in his carotid artery. Had to go into surgery for most of the day. Worst day of high school ever, not knowing if he was going to make it or not. Also a doctor. Couple of times come to mind. 1. Wife wakes up, decides not to go to gym as her stomach hurts, goes back to bed. This is unusual but I just went about my weekend morning of breakfast and TV. She wakes a couple of hours later, still sore abdomen. Have a look. Tender to touch and percussion. Tapping, not a great sign. Quick pregnancy test, we were trying, which was faintly and it was straight to ED. A few hours later and she's in OT for ruptured ectopic with 1/2 liter of blood in her pelvis. All okay thankfully. 2. This one was quite recent. At my son's group music class. Another kid coughing constantly. Sounds like a seal barking. Look at him and he's barely participating. Lying on his grandmother's lap. Neck muscles straining with every breath. Nasty croup. Grandma actually took a fair bit of convincing that he needed prompt attention. I live abroad, but went home to visit my family over the Christmas holiday and unfortunately had to leave my husband back in the UK. I got off the plane and I felt pretty crappy, but I just chalked it up to motion sickness from the long airplane ride. However, over the next few days I just got worse and worse. I felt really nauseous and exhausted, and I had terrible pain in my stomach. This went on for about a week. My mum was the first one who called it, told me I was definitely pregnant. I completely denied it. I had an IUD and I hadn't missed a period, so in my mind there was no way I could be pregnant. When my mum found out I had an IUD, she forced me to go to emergency immediately. Turned out to be an ectopic pregnancy. Luckily they caught it very early, so no damage to my fallopian tubes or my reproductive future. But yeah, she definitely saved me. If I had waited to go to the doctors after I had returned home, it would have been way too late. I have an IUD and an ectopic pregnancy is my worst nightmare. You have some stubborn sides there. For all other girls out there, if you are showing symptoms of pregnancy and you have an IUD, go to the doctor or you could die. When I was 4 years old, my mom realized I was drinking an abnormal amount of water. She had to go to work at that time. She's a doctor, but told my babysitter that if I asked for more water within the next hour to give me warm water. Warm water is disgusting and most children won't drink it. I, of course, asked for more water 5 minutes later and my babysitter told my mom right away. My mom was home within 10 minutes, and I was in the ER 10 minutes later. Excessive thirst is a pretty common sign of high blood sugar and my mom confirmed something was wrong with her hot water trick. I was diagnosed with type 1 diabetes that day. Nurse here was shopping for jeans and noticed a suspicious lesion on the sales assistant's arm. Advise him to get it checked. Go back 2 months later and same dude has giant dressing over his arm protruding out of shirt collar up his neck. Dude hugs me and says thank you, it was a melanoma. Crazy. Slightly off topic, but my mother, trauma surgeon, is the worst person to fly with. So far she has diverted 3 planes for people having in-flight medical issues and the plane not having enough the right supplies for the flight to keep going. She once got in an argument with the pilot about whether or not the patient was sick enough to cause a diversion. Also many years ago she was at a high school football game. Kid broke his arm and had no pulse in his wrist, meaning the blood flow to his hand was cut off. She field set the bone to restore blood flow, then put him in the ambulance. Then she went back to her seat to watch the rest of the game. I was a medical student at the time, so almost a doctor, I guess. I was walking to class with a fellow mid-student when we saw a guy in a disheveled suit passed out in front of a shop window. We lived in the East End of London, so it was a bit crappy, but we'd never seen someone outright lying on the pavement before. So we stopped to check on him thinking he was probably homeless and sleeping, but wanting to make sure. He was totally unresponsive to shaking and shouting, and at that point you call an ambulance no matter the circumstances. So we did and started checking all his vitals. Pulse and breathing steady but very slow, unresponsive to all but pain, moans and groans in response to knuckles on the sternum. Overall I'd have put him at a 5-6 GCS. We kept an eye on him until the ambulance arrived, which was very quickly as there was a teaching hospital just around the corner. As soon as the crew arrived they exclaimed something along the lines of "not this sucker again," and on seeing our shocked faces explained that he was a H addict and a frequent attendant of their A&E, and that he had in fact checked himself out of hospital about an hour ago. I'm in school now to become a physician assistant. One of our professors was telling us a story about his time in med school. They had actors come in to be patients for exams. I forget what the particular scenario was, but the patient had pretty significant edema that became visible in the exam. Our prof goes, "Do not do this during your examinations. I'm serious. Do not do this." What I did next was I turned to the camera. I said, "This is not part of my examination." He turned to the actor and said, "Are you seeing someone about the edema in your legs?" Actor, "No." Prof, "Okay, you are to not have any salty foods until you do. After this exam, I want you to call your doctor. Tell him or her you need to see them tomorrow." Okay. Actor, "Okay." Professor, turns to camera, "Okay, I'm resuming my examination." He passed. Not me but my dad, who's been an anesthetist for many years now. He used to operate before monitors were common in the less developed parts of the world and so used to monitor a patient's heartbeat by checking the pulse on patients' wrists. Over time he developed a habit from this, and when he handshakes anyone, his 2 fingers immediately go to the person's pulse. Once he meets an acquaintance in the street, sensed from the handshake that something was wrong and told him to go to the hospital ASAP because he had atrial fibrillation. That's like a superpower. I'm a nurse. When I first started working, I would see a patient and think, oh wow, this person really needs to go to the hospital and needs a nurse. Then I realized that's me and I panicked for a while. I had the same experience as an EMT. Someone should call 911. Oh crap, I am 911. Graveyard RN here. One day after I woke up, my husband said someone in our World of Warcraft guild was asking if anyone was a doctor or a nurse. So I logged on and talked to our guildie, who was having classic appendicitis symptoms, and I told him I thought he might have a hot appy. Didn't see him online for almost 24 hours. When he came back on, I asked how he was feeling. He said he was logging in from the hospital and had his appendix removed. I was glad I could help. I'm a psychologist in training with a specialty in developmental disabilities. It's always tough when I'm in a social situation and see a kid showing clear signs of autism, since early support can make a big difference. But it's very risky to even raise the possibility of such a huge bombshell outside of a professional setting. Also, an actual doc had a janitor who I was friendly with stop by to shoot the crap. Just small talk sort of stuff. He says, I've been doing great but my left leg's killing me. For whatever reason I say, is it swollen? No idea why. There are a million reasons for leg pain. It just came to me and of course it is. Right leg's normal. I think you have a DVT. You need to go get that checked. Like today. He, being a typical male, and I can say that because I do dumb crap all the time too, says, no, I'll just tough it out. Long story short, had to go to his boss to get him to go to the hospital. Clearly had a DVT and if I recall correctly had some small pays. Super nice guy, did fine. Your response is pretty cool but I don't know what any of your acronyms mean. My cousin is a nurse and I wanted a second opinion on my tit. After seeing my doctor the previous day, I sent a photo of my tit and my cousin replied hospital. Now, I had mastitis turn abscess from breastfeeding. It was the worst case anyone at my hospital had seen. Heck, they had doctors, nurses and students all coming in to see my tit. By the time I had surgery this infection was protruding and filled with blood and pus. It went from red and swollen to pus and blood within 6 hours. It was huge. After surgery they stuffed my boob with 5 feet of gauze. It was removed by one nurse who had zero clue I had no painkillers in my system at the moment. I bawled and screamed in the shower as she ripped it all out. She apologized after realizing I felt every bit of that gauze coming out. Worst experience of my life hands down. I had to have a nurse come daily and change my packing and bandages for 6 weeks because the gaping hole almost made me pass out after the gauze removal. In a hoe. Thank God my cousin told me to go. You have been visited by the skilled papa, replied it good, papa for a good skill. Thanks for watching. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.